Hello, my name is Samsam and I'm going to be doing the urine collection skills lab. Alright, so the first thing we're going to do before we begin is we're going to put don our items on. So I'm going to start with the gown. So I'm going to put, well, first I would start with hand hygiene. Perfect. So now that my hand hygiene is done and I haven't made contact with anything else, I'll put on my gown. So I'm just going to tie it here, and just for video purposes, we're going to pretend like I tied the back as well. So the next thing I'm going to do is I'm going to do my mask. Right. So I'm going to put my mask on. Perfect. Okay, so if I needed glasses for this, the next step would be to put on my glasses, but for this one I'm not going to, so I'm going to opt out. Okay, and then the last step for donning is going to be my gloves. So we're just going to come over here. Okay. So these gloves are a little tight, but we're just going to work with what we have. Okay, perfect. So now that we have all of our PPE on, now I'm going to come into the room. So I'm going to come in. Hello, my name is Sam. I'm going to be your student nurse for today. Can you please confirm your first and last name? Thank you. And can you please confirm your date of birth? Thank you very much. So today what we're going to be doing is we're going to be taking a urine sample. So is it okay if I were to move the bed up a little bit so we can be more comfortable? Thank you. So in this step, I would move the bed to my working height. Right. And then now I would proceed to ask for permission from the patient to let them know that I will have to move their gown up. So I will tell them, I would let her know. So I am going to have to move your gown up a little bit, but I'm going to make sure that only how much area that needs to be out is going to be out. Is that okay with you? Thank you. So what we would do is we're going to be closing and giving our patient some privacy.
It doesn't go anymore that way.
So that was the wrong one. So we'll be giving our patient some privacy. And for video purposes, we're not going to close it all the way, but we would close this off, give our patient privacy. Perfect. So now we would lift the gown until we need. Perfect. So now this is clamped for us so that any of the old urine won't mess up with our sample. So before I even begin this process, the first thing I would ask the patient is, are you uncomfortable? Are you in any pain? No? All right. Do you need to use the bathroom? No. Okay, perfect. So now we're going to start with collecting our sample. So I'm going to put the pad down here, just in case there's any droplets or anything, just to be as safe as we can and as hygienic as we can. Okay, perfect. Now the next thing I'm going to do is I am going to get my sample and I'm going to have the cup ready for me like this when I need it. Perfect. So now the first thing we're going to do is we are going to swab this area right here. So we're going to take it, we're gonna swab. Perfect. Just gonna talk to the patient, you know, and the normal. This was a real if I was really with the patient, I would try to make conversation. But for now, we're just gonna go with this. So the next thing after we've done the swab, we would now put it in there, and then we would collect our sample. Right, perfect. Then we would come over here. Perfect. And we would put our sample in here. Put this down here. Close our sample. Then we would put the label on here, and then we would put it in the biohazard. Then we would ship this off, and we would have to ship this off within 30 minutes. Perfect. Then we would take the clamps off. Then we would take this. This would go into the garbage, and then this would go to be sterilized. Perfect. Then to tell the patients, thank you so much. I'll just put your gown down, and then I would put their bed down to where they're comfortable. Then I would let them know, thank you, have a great day, I would leave. So now we're going to do the offing of the PPE. So the first thing that would come off here are my gloves. And I would just go like this. Then go from here. And that would go in the trash. Next thing would be my gown. So I would go like this. And then I would grab from the inside. Take it off like that. Then I'd roll it up. Discard of it as well. Then if I was wearing glasses, that would be first. And then it would be my mask. Thank you. And that'd be all for my video.